You know, I always get this question about grapefruit. Is it okay if I consume some grapefruit, thinking it's a lot different than an orange? So I'm just going to create this short video on this fruit. Grapefruit is high in vitamin C. It has citric acid, so it can actually decrease the risk of kidney stones. It has lycopene, which is good for prostate problems. But one thing about grapefruit is that it has a certain chemical that inhibits an enzyme in your liver, which blocks the breakdown of medication. And so the enzymes that normally metabolize the great majority of drugs in your body, so grapefruit inhibits that function, causing a greatly elevated concentration and accumulation of those drugs. In fact, if you take certain medications like statins, antidepressants, high blood pressure medication, and at the same time consume one grapefruit or a glass of 7 ounces, which comes out to a little over 200 grams, you could potentially have a drug overdose. It can be very toxic. But that's not the biggest reason that I would recommend not consuming grapefruits. The biggest reason is because it's loaded with sugar. 1 cup, which is 230 grams of a grapefruit that's cut up in little slices, gives you 25 grams of carbs or 16 grams of sugar. That is a lot of sugar. Now, it's slightly less than an orange, but still, it's way, way too high. And I do understand a lot of people love grapefruit, but the problem is it's just too darn high in sugar.